How'd it go?
Great. You know, she was very worn out hip. Very, very worn.
Was
you know?
it?
Yeah, I mean, there was no cartilage left and lots of spurs kind of sorts. What it would look like if it's worn out.
Yeah.
And we've got a nice new hip in there, very little blood loss. She's got nice anatomy, you know, she's in
Yeah.
good shape. Yeah, so it was, for me, my world, very easy one to do.
Okay.
You know, the bigger ones are
Yeah.
harder. So it went extremely smooth, very little blood loss. I expect she does great. We just have to slow her down for a few weeks.
Yeah.
That's the
She's
key.
active.
I know. She's just got to give us that 4 to 6 weeks to let things quiet down. Because she'll feel good and she'll want to do something, and then she'll flare it a little bit, and that's where we have to be careful.
Okay.
I tell her the nicer she is to it in the first few weeks, the quicker she's going to get better. So she should be upstairs in about an hour.
Head back.
Okay.
And we'll take real good care of her.
All right. You didn't notice anything out of the ordinary, or?
She has good anatomy, you know, just a worn out joint. So she should do great.
Yeah. Well, you came with good recommendations. We've heard.
Yeah, I'm pretty well known in the neighborhoods around that area. A lot, you know, that this
Okay.
worn out joints have kind of become the thing we do a lot of. So Summer and I, we'll do 10 this week. It's pretty steady.
Is there anything that Marnie should be I think we saw the little video. But is there something that's really bad to do?
You know, I mean, you don't want to push through a lot of pain. I mean, that's, you know, you want to push through a little discomfort. The most important thing is to listen to the restrictions that the nurses give you upstairs. And they'll tell her, the therapist will tell her quite a bit about how to do things. Just till the tissues heal. Once the tissues heal, she can do whatever she wants.
How long does it take before the actual insertion into the femur and all that is actually bone tight?
Yeah, I mean, it's tight like a nail in a board now, like it would be hard to get out. However, the bone will grow to it and make it almost impossible to get out over about 6 weeks.
Okay.
The chance that it doesn't grow to it is there, but it's extremely low, much less than 1%.
Okay.
We see one on occasion every few years it doesn't grow in. We usually relate that to too much activity early on.
Now, she is a tennis player. She probably told you that.
Yep.
She's going to probably want to get back and do some of that. When would that begin to occur?
I like sports to be closer to 3 months.
Okay.
I think that you can find people that say 6 months, but no matter what I tell them, I mean, I did an ER doctor here, and at 6 weeks he was, you know, back doing all of his activities. I did, you know, Dr. Wired's hip here last summer, and he played golf for 4 weeks, despite anything I said.
Yeah.
I mean,
Okay.
so I mean, we really like 12 weeks.
Okay. All right.
Yeah.
Well, thank you. Nice meeting you.
Yeah, nice meeting you.
Yeah.
Check in with them. They'll give you a room number, and should be upstairs in about an hour.
All right. Thank you very much.
You bet.
Bye, doctor.